Everybody, Andy here again. Good morning. Once again, I think this is day 14. It's getting like that, isn't it? I'll put the figures down there once again. And where are we? Yesterday, 439 deaths, and that makes a total of 5,373. But I must admit, the BBC on their news yesterday were at pains to point out, as I've said before, that these deaths are only the ones that have actually happened in hospitals, not the ones that have happened in the wider community where people are self-isolated at home and maybe unfortunately died, or in care homes and places like that, which, as we know from, especially in Europe, once the virus gets into a place that's full of elderly people, unfortunately the results aren't always very good. And the amount of people tested, 208,837. So it's going up, but it's not going up fast enough, I'm afraid, in my opinion. The only way we're going to come out of this is a lot far more testing as they're doing elsewhere. The Daily album I should put down there yesterday was actually Joy Division's Closer, which came out, I've got it written down, in 1980. It came out in July 1980. Unfortunately, a couple of months after the lead singer Ian Curtis took his own life in May of 1980, which is nearly 40 years ago, which I find absolutely unbelievable. I remember buying the album at the time, but still. Right, the main topic of conversation today, I suppose, obviously, since yesterday I mentioned the fact that Boris Johnson, our Prime Minister, had gone down with and got coronavirus himself. Now he's in intensive care in hospital. He'd been taken into hospital, I think, yesterday. Last night he was taken into intensive care. I understand that he's not on a ventilator, but has been given oxygen. But obviously it's cause for concern, obviously for his family, but for the country as well, for that matter. Yes, I don't wish anybody ill at all. And as I mentioned, not his greatest fan, but I want him to get well as I want anybody else to get well. So, but another one of those things yesterday I mentioned about the Scottish chief medical officer getting caught out. A medical officer in the government in New Zealand has got caught out as once again taking his family to the beach, driving his family to the beach and everything. He hasn't resigned, but he's been demoted and that sort of stuff. And it's one of those things that ultimately people are going to be held to account for this. People are going to remember this. I mean, governments, they've got a pretty much an impossible job. I totally understand that. What do? You go too soon, stop things too soon, go too fast, and you get the backlash and all that. They're doing what they can at the moment, although I do think some of them weren't, especially in the early days, taking enough notice of the science that was out there, and also the examples of what had already happened in China and in parts of Europe as well. And unfortunately, ideology did get in the way of some governments. Let's put it that way. So that will come out in the long run. But also, just people and companies. I've seen here, especially in the early days, there was a real backlash against certain companies who, when they were laying off staff and not refusing to pay them, that type of thing. And I've seen people talking about having lists of companies, national companies and even more local ones as well, that haven't really done what they could have done, not been particularly charitable and haven't looked favourably on their workers, the people that keep them going all that time for whatever reason. I've got a few. A local pub chain called, well, not a local, national pub chain called Wetherspoon certainly was one of the ones that's been taken to task over that. Ultimately, a lot of them have changed their tune, but as I said, people have got long memories. They're going to remember this. And another one at the moment, we've got the sort of Premiership footballers. They may be scapegoats because there are plenty of other people who have got lots of money who could be dipping into their pockets as well. But some of the big football teams over here in the UK are taking advantage or trying to take advantage of the government scheme where they can furlough their staff and the staff will get 80% of their wages effectively paid for by the government when their sort of top stars, the footballers and other sports stars, I'm sure as well, are getting tens of thousands of pounds every particular week. I know some of them, we're in an impossible position where you could stand up and actually say, you know what, I'll take a pay cut, as some people have. Some CEOs, some other high-ranking people in companies have said, right, I'm not going to take any money for the moment. Some football managers have done that, taken a pay cut, etc. They're leading by example. It would be good to see other people leading by example without actually being forced into doing it. And I saw one football club yesterday that had backed down on doing that. A bit too late. If you do it, once again, you'll get remembered. But some things will come out of this. Some people will come out of this well, whether it be the local shops who've kept you going, the greengrocers, the bakers and everything that you've seen, the local companies, the local shops or whatever that have made your time a bit better. They've gone the extra mile to try and keep their services going. They've been innovative as well. But national companies as well can do that. But there are, I think I've written a couple down actually, there are three things I think here in the UK certainly that are really going to benefit from this, and they're all places or all organisations or whatever that have been under the cosh, should we say, over the years from successive governments, but especially, unfortunately, the one that we've got now. The first, obviously, being the National Health Service, the NHS, which has really come into its own now. And the government's policy, as you've probably seen if you're in the UK, is protecting the NHS. The whole reason that we're in a lockdown is not necessarily to stop the spread of the disease or the virus quite so much. It's to try and reduce the amount of people that are going into into hospital. I know that tends to be the same sort of thing. That's what I saw a post saying that totally yesterday. It's not trying to stop you getting together. They're trying to protect the spread of the virus. They know the virus is going to spread, but if they can lessen it, they can lessen the impact on the hospitals and that, which I know is happening all over the world. We've all seen the pictures of, in Europe, here and in America as well, where places are being swamped by the amount of people. So they're trying to lessen that. And those people working in those hospitals, all the different staff that have worked in those hospitals, that in the past have been undervalued, certainly underpaid, are now leading the fight, definitely, and they're getting, we're applauding them every Thursday at 8 o'clock, including the government ministers who tried to vote down their pay increases only not that long ago. So what comes around, goes around, comes around, and all that sort of stuff. So I think they're safe now, because there's never going to be a situation where they're going to be able to not fund the NHS over here properly, or even sell bits of it off, which they've been talking about trying to do through the back door or whatever in the past. I think those days are gone. The British public won't ever let that happen again. One of the others is the BBC, actually. Certain sections of the media, print and TV as well, and certain sections of government, etc. as well, have been trying to knock down the BBC for a number of years, but partly because they can't control it. So it's paid for effectively by public subscription, by a licence fee, but they're politically neutral. I mean, like everybody says, both sides of the political argument say that the BBC are biased, which must mean that they're probably doing something right in the end. But they've come into their own, because apart from the TV station, they run six national radio stations, plus countless local radio stations as well, plus the website, plus the iPlayer, and all these different things. They change their schedules and move things around to help people at home, kids, etc., education, which other companies can't do, and all for a fee which is, yes, it's more than Netflix, but you'd never get the same sort of service from somewhere like Netflix, and I think people have started to realise that. Hopefully they won't be under the cosh anymore in the future. People will realise that actually we need people like this, we need companies, and just those sort of broadcasters like this in times like this, not biased ones, which which you can see all over the place as well. And the other group are just what we're now calling essential workers, all those low-paid people who do what we always thought of menial jobs, whether they be cleaners, supermarket workers, sort of shelf stackers and delivery people, road sweepers and dustmen, and all those type of people, carers, especially obviously the people in the health service, all who have been undervalued and underpaid for a long time now, and then suddenly they're the heroes and heroines, quite rightly, but they always have been. So now is the time to sort of stand up, I think, and look after those people in the future and give them what they should be getting, which is a decent wage and a lot more respect than they've had in the past. And also, one thing, we need to look at it ourselves. Will you, at the end of this, be able to look in the mirror and think, I did my bit. I didn't go out there and buy multiple packets of toilet rolls or wipe out all the tins of beans and pasta and things like that. And all the little things that we can do, even helping out your neighbours or helping out your friends and looking out for people, that type of thing. And not disobeying all the rules like some of those people that I mentioned earlier on have done several times. We need to do that in the future. Look at yourself in the mirror after this is over and say, yeah, I was all right. Yeah, I'm okay. I didn't sort of break any rules, didn't do anything stupid. I behaved myself, if you want to put it that way, and you all played your part in getting through this really strange situation. Strange days indeed, most peculiar mummer, as I believe. John Lennon said that many years ago. So anyway, I'll leave those thoughts there for you. Look yourself in the mirror and think, am I doing the right thing? And if you're not, maybe we can improve on it. Well, we could all improve on it, couldn't we? But there you go. Anyway, I'll leave it there. Thanks for your time. Speak to you again tomorrow, hopefully. Goodbye.